bad, but it was just a little.
Just a little. Yes.
Gotcha.
But it's cool. Unless, because I don't think he's too close.
Now,
to
and
the
you're
mic.
welcome to use those.
Okay,
Tonight.
I was gonna ask you.
Yeah. I sent you an email and I said, feel free to use these as well. Go ahead.
You start the new job?
Not until the 11th.
11?
It's cut off. Oops, you can't hear me. We're back on again. Can you hear me?
Yep.
Talk for me, JP.
Talk again.
Talk
Say
again. Can you hear me on the? When the stuff is playing in the commercial, normally I can't hear them.
That's
Like you. Yeah, I got you. Okay.
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 Yeah, as long as you can hear the programming. That's
It was kind of staticky from yours.
Well, and that's why I pulled my volume down,
Okay.
because I know that Robin had told me a listener, somebody told me, and Robin told me to pull my volume down, and they'll take away that.
And
Because it just had an edge of it.
sometimes it might be the headphones.
Oh, sure, I
Yeah.
guess.
Yeah.
More, it might be
These
the
aren't the world's
headphones
best.
more than.
These aren't the world's best.
Mine are the worst best.
Robin,
Yeah.
have you met Dr. Clothier?
Robin.
Yeah,
Oh, okay.
Yeah, absolutely.
Yeah, if you're
So you
regular
get
Dr.
to-
Clothier,
you get-
that might be a good Christmas gift.
Yeah.
Headphones for him.
I'm fairly regular, yeah. That,
I'm gonna listen from my desk, guys, okay?
I don't get asked about that by
Okay.
everybody.
Here we go, stand by.
It's so weird. Oh. JP? Well, I was gonna ask a question. Can't hear me though.
Well, good morning, Dallas, Fort Worth, and I'll tell you what, the bells are jingling because Christmas is right around the corner. I went out to North Park Mall yesterday, and I'll tell you what, I took all my patients with me, and I hope you took all yours, Dr. Clothier.
Absolutely, mine follow me everywhere.
I imagine
Yeah.
they do, I'll tell you.
Did you see Santa?
I did get to see Santa
The best
yesterday.
Santa?
The best Santa in the
best Santa.
Metroplex, yeah, that's right. But I did take all
I
my
thought there
patients.
was only one Santa.
Oh,
Is that
yeah.
right? Yeah.
It's all his
Well, he-
helpers. It's all his helpers.
Yeah, it's the helper Santas.
Okay.
Yeah, the helper Santas,
He
Dr.
takes the
Clothier.
word and sends it to the big Santa.
The big Santa. You know, there's lots of big Santas.
Yeah.
That's all right.
But there's only one big Santa.
One big, okay.
Santa. Well, I'll tell you what, though, folks, if you go out to the malls this week, do take your patients with you because traffic is fun. Yeah, action. Oh, are you kidding me? I got so many gifts. I got gifts of what are you doing? Gifts of why are you parking there? Gifts of, hey, dude, are you moving? I got so many gifts, I didn't even want to go in and go shopping.
Wow.
Oh, a gift for you. Yeah, I've got a gift for you. It's called Don't Go to the Mall.
Yeah.
Wow.
My mom said she went to the Stonebriar Mall and it was a madhouse.
Yeah, so the fun has begun. I can't wait to talk to Holly tomorrow morning from the Galleria. We're going to have fun with that, I'll tell you. And we're going to talk tomorrow about proper etiquette when you go shopping on Christmas Eve and proper etiquette on the day after Christmas tomorrow with Holly from the Galleria, and she's always fantastic. But before that, we want to bring you The Choice As Always Is Yours by Lori. That segment is brought to you by All Smiles Dentistry. They have served Allen residents for 15 years and the official team dentist for the Allen Americans hockey team for the last 7 years. All Smiles can help you identify and prioritize your dental problems early, maximizing your dental benefit. Call 972-747-1996. That's 972-747-1996. And visit their Facebook page at All Smiles Dentistry Allen and read what their happy families are saying. So, Lori, inspire us. Well, I think there's some good information there.
Yeah, and I think I'm going to take about 4.5 hours to explain the thyroid here. I,
Patience, huh?
absolutely.
Patience.
I want to live it.
Well, you know, and I think that one of the questions we've had come in both from Malaysia and from Robin is, does the thyroid, does it impact children?
Yes. every person has a thyroid unless that thyroid has been removed surgically. And so most everybody you know has a normal thyroid. I would suggest, though, you know a lot of people who are on thyroid medicine who were hypothyroid and are now successfully treated with it, and you wouldn't know because they live normally with a replaced thyroid function, basically. The when the thyroid decreases in function, or hypothyroidism, as I was mentioning off the air a moment ago, I have 2 teenage patients right now with hypothyroidism, so it's not very common. I see a lot of teenagers, and I'm not sure exactly what the percentage is there, but only 2 of them have hypothyroidism. And they were both fairly easy to diagnose based on their symptoms of weight gain and actually depression, where we did the blood test. But if you do a simple blood test, we tend to look at 2 factors usually. One is called a TSH, thyroid stimulating hormone. And that's actually a hormone level that comes out from the brain and goes to the thyroid and essentially tells the thyroid how much thyroid to put out into the body. When that stimulates the thyroid gland to put out the message to the body from the thyroid, that is T4, or what we tend to measure with the blood test, free T4, which is levothyroxine. And if you ever hear of Synthroid or levothyroxine as a treatment, that's an exact analog of the body's hormone, meaning it's the exact copy. So when treated, you can be treated with exactly what the body has in it for the thyroid and be very successfully treated. I think anecdotally speaking, if you look back at history, when people, 100 years ago, people lived about 30 years shorter in their lifespan. Some of that obviously was prairie lifestyle and disease and whatever. But I think if you look at stories even like Little House on the Prairie or whatever, you hear of, kind of grandma and grandpa kind of going to bed and sort of fading away and slowing down and dying. I think a lot of those people had hypothyroidism and just nobody knew it, and their body would just gradually slow and slow and slow more till they finally basically just passed away. And it's a very treatable thing at this point.
Now, how would the body be without a thyroid?
With no thyroid, you would basically slow down literally to the point of coma and death. So you must have thyroid drive the body's sun. I would say it's almost like putting gas in a car. If you don't have any gas in the tank, you can't start the car and you can't drive it. It doesn't mean the car has to be replaced, you just have to have fuel. And the fuel in the body, in many ways, could be seen as the thyroid is the driving gland.
With no thyroid, how does weight fluctuate? Because you talked about with a thyroid problem, but with no thyroid.
Right. Well, again, we have to kind of put that in perspective, because if you have no thyroid, you'd have no function. So, at some point, very quickly, you die. If you have your thyroid removed, you can replace it with the levothyroxine and replace it to a normal level by following blood tests on that.
Now, how rare would you have a patient come in that needs the thyroid taken out?
Yeah, I probably see a couple a year. It's not common, but the term goiter comes into play there, where people, and JP mentioned earlier that he maybe has seen some women he feels have an Adam's apple. When you see someone with enlargement in the neck, that can be a goiter or a thyroid nodule, which looks like an Adam's apple. The Adam's apple being more of a male feature based on the muscle structure and the hyoid bone. But if you have the enlargement in the neck, that may be a thyroid nodule that may need to be addressed by surgical removal.
Does childbirth or being pregnant, does that impact a woman's thyroid?
It can, because that's a stressor on the body that requires change. In other words, when you do something that brings about a significant change in the body, the thyroid must respond to that. That's sort of our God-given way to respond to increased respiratory rate, increased pulse rate needed for pregnancy to feed both the mom and the baby in terms of oxygen and body supply. And so during pregnancy, that can be a time that the thyroid can have dysfunction. What I find more often is if someone who is previously hypothyroid becomes pregnant, they often need more thyroid during pregnancy because their own thyroid can't sort of crank out that thyroid hormone level. So they need to be checked more often by blood tests and treated appropriately. And then after the pregnancy, they very well may go back to their pre-pregnancy dose.
So whether you've got a good thyroid, a bad thyroid, what is generally the key to maintaining weight loss or creating weight loss?
Right. The trifold issue there, I guess, or the three big ones are exercise, eating right, and then making sure you have a normal thyroid. And so if you have a disturbed thyroid, either hyperthyroid or hypothyroid, you need to follow along with blood tests based on your doctor's plan for you. Typically, if I see somebody with a new diagnosis of hypothyroidism, where their thyroid function is off and low, then we can replace that with medicine like levothyroxine and recheck them at about 6 weeks, then about 12 weeks, and then maybe every 3 months for about a year, and then a couple of times a year for life, really is the key. You're really never done. The way I tend to describe the thyroid replacement is if you viewed the treatment like from the floor to maybe the top of your head or whatever in terms of the full level, and let's say you drop by 25%, you can replace that, but you never know when your body might drop a little more. Since we're a little short of time, I do want to address thyroid cancer briefly. About 97% or so of thyroid cancers are what we tend to call follicular or papillary, and they're considered curable, like by surgical removal or a chemical treatment for the thyroid. So most thyroid cancer, while sounding scary, is a very, very curable thing. And if somebody has a thyroid cancer and has it removed, they can be on thyroid replacement and live a normal life. A very small percentage are medullary or anaplastic cancers, and those are far more aggressive and serious and often need radiation or other treatment. Medullary is considered more curable. Anaplastic is a bad disease, honestly, but thankfully very, very rare.
You know, Ken, we have another question that came in, Dr. B. You mind if I cut you
Yeah,
off on
go
that
ahead.
deal? What about after childbirth? You know, because the hormones, depression, all of that, does a thyroid make a play in that? That's what one of our listeners
Yeah,
wants to know.
it can. There again, you can check a level and find out. So I tend to recommend if anyone has a suspicion, they're checking about 6 weeks after childbirth, maybe at about 3 months. And realize too, the thyroid can have a little lag. It may take a little time between finding a low level and replacing before you feel better, maybe about 6 weeks.
I just have a quick question. I had someone ask me who had thyroid cancer and had radiation treatment. She wants to know if it can cause early menopause.
Yes, because the thyroid drives the hormonal system of the body too, and so it certainly can affect that in variable ways depending on the person.
Well, Dr. Clothier, I'll tell you that's going to bring us to a close, but I want to wish you and your family a very Merry Christmas and a Happy New Year, because we will not see you now till after the Christmas break.
I guess that's true. So Merry Christmas to each of you, and as always, I appreciate being a chance to be a part of the show.
Well, you are fantastic. I know our listeners have really been able to gain a lot of information from what you've given us. And
Well, I appreciate
So-
that. Blessings to everyone for Christmas.
absolutely. Well, folks, we are KEX.